Morning, everyone.
Good morning.
Morning, Cable. Can you hear me? Ashley, everyone knows this is virtual today, right?
Yes.
Okay. Office of Cable Television, can you hear me?
Good morning, council member. This is Juan. We're ready when you are.
Okay. Thank you, Juan. Just give me just a second. All righty, let's get started. Good morning. I'd like to call this hearing to order. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today is Thursday, June 8th, 2023. The time is 10:01 a.m. We are holding a virtual hearing via the Zoom internet platform, and this meeting is being broadcast live on cable channel 13, as well as on my YouTube page at CMC Henderson. The Health Regulation and Licensing Administration, or HRLA, is a division of DC Health that seeks to protect the health of district residents and all those who do business here by fostering excellence in health professional practice and building quality and safety in health systems and facilities through an effective regulatory framework. HRLA's 19 professional licensing boards support HRLA in administering the licensure of almost 70,000 health professionals here in the District of Columbia. The boards advise DC Health in matters pertaining to the development of rules and regulations for health professionals and provide additional services, including licensure verification and licensure examinations. Today, we will hear testimony from public witnesses and members of these 5 boards: the Board of Marriage and Family Therapy, the Board of Professional Counseling, the Board of Dentistry, the Board of Optometry, and the Board of Respiratory Care. Members of all 5 of the boards are appointed by the mayor with the advice and consent of the council. The boards evaluate applicants' qualifications and administer examinations, recommend standards and procedures, and issue licenses. I will say a little bit about each of the boards before the board chair or folks from the board come up to testify, as opposed to doing it right now. But I will say, we've already done a oversight hearing of 5 boards already. So this is another 5. So we are making our way all the way through. I don't see any of my colleagues who are here right now. And so I'm going to turn to public witnesses. But before we get started, I want to review the testimony guidelines for public witnesses. Witnesses representing an organization will have 5 minutes to speak, and witnesses testifying on their own behalf will have 3 minutes. We have a clock that will begin counting you down when you start speaking, and then I will give you a nudge when your time has expired. For anyone who is not able to speak today, but wants to have their voices heard on this matter, we'll be accepting public testimony until June 22nd, and you can submit written statements to the committee on that matter. I will call up the first panel of witnesses. Give me just a second. Okay, Kurt Gallagher, who's the executive director of the DC Dental Society, and Tony Reeves, RDH, BSW. For those who haven't testified with us before, you need to proactively accept our invitation to become a panelist in order for you to appear on the screen. So I will wait for those individuals to be let in. My other bit, I see someone in the room whose title is quote unquote owner. If this is Tony Reeves, if you could either put something in the chat or change your name so that we know who you are. But I see Mr. Gallagher. So Mr. Gallagher, when you're ready, we'll start with you.
Good morning, Chairperson Henderson and members of the council. Thank you for the opportunity to testify today, and we appreciate that you are holding this oversight hearing on the Board of Dentistry. I'd like to just express the appreciation. Unfortunately, I'm the only one who is representing the dental society and dental community today, because with the short notice, it wasn't possible for some of our practicing members to join, but they may submit written testimony afterwards. I want to focus my comments on three areas. Number one, the statutory, regulatory, and operational barriers that exacerbate the staffing challenges for dental practices here in DC. Number two, the composition of the Board of Dentistry and the practices that are followed by some of the appointed board members. And then lastly, I do want to note some areas of improvement that we've seen over the last couple of years with the Board of Dentistry. One of the biggest challenges for dental practices in DC remains the staffing situation. Practices have a challenge securing staff, and the process of actually getting licensed in DC contributes to that process, contributes to that challenge. First of all, we're calling upon this committee to repeal the requirement that level 1 dental assistants be registered in DC. This has been in place for maybe about a decade, and it becomes a barrier for getting staff in DC. For those who want to apply to become a level 1 dental assistant, they need to pay a fee of $240 for both registration and background check, whereas in Maryland and Virginia, there is no fee because registration is not required. So DC is really an outlier in terms of our region, and actually in many states across the country. For those who actually apply for a registration renewal, even for them, the fees range from double to up to 12 times higher than what it would cost in Maryland and Virginia. So this is a significant barrier, this disparity in the registration fees. In my written testimony, I will provide a table that outlines and shows all these fees and provides links to the sources so you can compare them. For those who will be renewing a license this year, there was a recent announcement from HRLA about the requirement that a background check be required for all renewals. So that's an additional $50 that all of these applicants will need to pay. So this is yet again another barrier, both administratively in terms of cost for those who are considering actually working in DC versus whether they should work in our neighboring jurisdictions. So DC is actually an outlier in terms of the states that require a background check for renewals. I'm conducting a survey of other state dental societies. I've received a response from 20 of them so far, and of those 20, none require a background check for license renewal. So we really do stand out in a way that's not supportive in terms of fostering the workforce in DC. Once someone decides to actually get a license, apply for a license in DC, then they encounter what's probably the biggest challenge, and that's the process of getting approved by the Board of Dentistry. I received a steady stream of requests for help from applicants who have been calling and writing to the Board of Dentistry and received no response. This can go on for weeks and sometimes months for applicants. We have a number of specific recommendations that I'll include in my written comments, but providing meaningful communication to applicants in a reasonable time frame is critical so that these applications can be processed and any deficiencies can be remedied. The board staff regularly blame the applicant, but when it takes weeks and months to get a response, essentially the board has taken ownership of the problem. So it's no longer the fault of the applicant, it really is on their desk in terms of resolving these issues. I would also like to address again the composition of the board itself. There are 5 dentists on the board. One of those seats has been vacant for more than a year, effectively. 3 of the 4 that serve are essentially retired. And the one who remains works at St. Elizabeth's and is a relatively new resident of DC, the DC area. So the board actually lacks that practical experience and knowledge of what practices are facing every day to operate a dental practice. And as this committee takes up the new legislation that was introduced recently in DC on the Health Professional License Board Residency Requirements Act, I encourage this committee to consider if there's a way to establish minimal thresholds for actively practicing health professionals in terms of those appointments. I think that would help bring in this real world perspective that's missing from the Board of Dentistry and perhaps from other boards. And then lastly, because I know I'm running out of time, I'd like to get a legal opinion from this committee about one of the ways that the board is working. It operates using subcommittees to develop policy recommendations, but those subcommittees work in private. Meeting agendas aren't provided to the public. The public has no opportunity to attend those meetings. Meeting minutes are not provided to the public. And when the general counsel of the Board of Dentistry was questioned how this complies with DC's open meeting law, the explanation given was that the meeting law doesn't apply because a quorum is not present at these meetings. Well, of course, a quorum won't be present because it's a subcommittee, which is always a subset of the board. So this may comply with the letter of the law, but it certainly doesn't comply with the spirit. And the board can certainly operate in ways that elevate its operations rather than just meet the bare minimum requires in DC. My written comments will also highlight some of the areas where we've seen improvement with the board, but I'd be happy to answer any questions we have, so I don't want to take additional time unduly. So thank you, Chairman Henderson.
Thanks, Mr. Gallagher. Let me just ask once again, I don't know if the person who is in the attendee room with the title owner, if you are a person who's intending to testify as a public witness. If you are, we need you to change your name from owner to who you actually are. So I'm just going to give it a couple of minutes here before I ask Mr. Gallagher. If you could just be a little bit patient with us, Mr. Gallagher. I don't want to start questions if this is a person who intends to testify.
No problem.
Okay. All right. Well, Mr. Gallagher, thank you so much for being here today. Oh, hold on. Okay. Who is titled owner? If you want to testify.
Hi, this is Tony Reeves. Can you hear me?
Yes. Okay. I'm glad that we I thought that might have been you, but
Okay.
you can go ahead and provide your testimony.
Okay, great. Sorry for the confusion. Good morning, committee members and others. Thank you for this opportunity to speak. I will read aloud my written statement and will not state the links for the data. Improvements could be made in the following area. Point 1 of 6. Contributions in the area of school wellness policy from dentists and hygienists. Children in the United States aged 6 to 12 miss an average of 30% of school days from oral health, an average of 0.49 days per child missed due to poor oral health. Funding and opportunities are needed for this to occur. Point 2, knowing your numbers. Dentists and hygienists can provide educational information of knowing your numbers for blood pressure, diabetes, or kidney health. The same is true for periodontia, gingivitis, tooth mobility, occlusion, or number of missing teeth. Emphasis will be placed on the importance of cleaning the mouth after eating or sugary drinks. Same importance of cleaning hands before eating. This is crucial for kids in school. The school day is long. Having the opportunity of my nonprofit to implement our theme song and switch techniques to kids in school, summer camp, before and after school can make a difference. Additionally, funding would be helpful to continue collaboration with Howard University for the pilot study. The study was for opportunity to announce it with the National Institute of Dental Craniofacial, the NIH, for a behavior and social intervention grant. Point 3, promoting careers, entrepreneurship, and dental hygiene. The community could benefit in terms of greater access to care. For example, nurses are providing service to the community in a variety of ways. School teachers provide services in a variety of ways. This could hold true for the dental hygienist. Educational sessions and participation in health fair and health centers for oral cancer is important. Oral cancer is diagnosed in late stage, about 53,000 diagnosed a year, 8,000 deaths. Educational sessions about human papillomavirus. HPV is the most common sexually transmitted disease. Some cause warts, precancerous lesions. These warts can appear in the mouth, cervix, and they resolve, 90% resolve spontaneously within 2 years. Point 4, enforcement and legislation of dental needs clarification. It's clear the duty of the dental board is to enforce rules and regulation. Who legislate, for example, administering of the vaccines, nutritional counseling outside the dental office, malfunction assessment, healthcare visit for children newborn to 2 years oftentimes is in the medical office. The child is required to have assessments and immunization at this age. Fluoride supplements and breastfeeding consultations. Dentists and dental hygienists could provide services, probably with a legal freedom, interfere with breastfeeding. Point 5, funding in other areas of opportunities needed. For example, job readiness for returning citizens in place, such as resume development and business attire. Attention to dental hygiene is important too. Session for behavior changes include some of the same steps for therapeutic care counseling. Point 6, another area of funding and opportunities needed to hire staff to provide dental services in the private home, assisted living homes, extended days in the hospital. Dental prosthesis need cleaning adjustments. The mouth needs assessments. Teeth needs brush, floss, scaling, and fluoride treatment is needed. Within 8 years of incapacitations and limited dental care, recurrent decay and new decay occurs. Implant fails, periodontal health deteriorate. I'm looking forward to improvements, equity, and accessible dental for all. Thank you, Tony Reeves.
Thank you, Ms. Reeves, for your testimony, and thank you for being here. I do have a couple of questions. Stick around for a little bit. Okay, Mr. Gallagher, I wanted to thank you for being here. Thank you for your testimony. I wanted to ask about a couple of things that you mentioned. So first, the thing that you talked about was the repeal of licensure for level 1. Based on the last census I have, is that there are about 137 level 1 dental assistants who are currently licensed in the district. Did you say that both Maryland and Virginia don't require licensure for level 1?
That is correct.
Okay, and that this was a new requirement, or relatively new, about 10 years old?
Approximately, yeah. It predates my time with the society, but talking with other members, that's what's been described to me.
Okay, so we'll go back and look and try to figure out, or maybe ask the board chair to try to understand the impetus for why we would add, or why that was added, and then try to understand that a little bit more. But you also mentioned that now they'll be requiring the background check for all renewals, which would cost an additional $50. I understand a background check for new folks who are new to the area. But was there any explanation provided in terms of why this additional background check for renewals?
There was not. There was a communication. I can send you the link, or actually maybe I can put it in the chat so you can take a look at it. It came out on the 25th. It was sudden, I think, poorly worded, so it created a lot of confusion. But it does assert that effective immediately, all applicants were required to complete the new CBC for each application submitted. And it cites the actually DC law, which requires it for renewals as well. So let's see, can I put this in the chat?
Okay, we might have the chat disabled. Maybe if you can shoot us an email with that, or we can certainly look on the Board of Dentistry website to kind of learn a little bit more about that.
Certainly, I'll send it afterwards. Yep.
Okay. So in terms of the board makeup, and Ms. Reeves, if you have any comments on the board makeup as well, would love to hear that. I think your testimony was very specific in terms of the practice of what dental hygienists can do, what needs to be done from a public health standpoint. But, you know, there are a lot of boards who have a lot of vacancies, and the Board of Dentistry is not one of them. Mm-hmm. And so I'm curious, though, my understanding in terms of how nominations come to the forefront is that either individuals can go to the mayor's office of talent and appointments and like submit a application to say, hey, I'm interested in serving, or that the board itself or DC Health can make recommendations to the mayor's office of talent and appointments to say, hey, this is a good person to serve. To what extent, if any, are you hearing that members want to serve, but they haven't been given the opportunity?
I've heard from, I'm aware of at least one member that has applied now twice for the last year. And had an interview process about a year ago. But interestingly, when the person asked, well, what's the next steps? When am I going to hear? They were told, well, I don't know. We haven't made a decision. All to learn that by that same date, the person who was nominated last September was already noted on the MOTA website. So the person was given inaccurate information by a representative of MOTA. We've actually been encouraging members to apply. I know that there are others have applied. One applied late last year and was basically, we've learned that the application is now dead and it needs to be sort of resubmitted because it's sort of expired. So the person is resubmitted this year, but hasn't heard anything from MOTA regarding that resubmission. And I expect that there will be others that are submitting.
Okay.
Process just doesn't seem to have a lot of transparency in terms of what's happening in terms of review of those applications.
Yeah, I mean, well, and admittedly, we don't necessarily have a lot of insight into that process, because one of the things I was asking my staff was, okay, so I submit a form and then what happens? Does it ping to somebody's email to say, oh, someone has submitted an application for the board of optometry and we have a vacancy, and so we should go ahead and fill that. But just for folks who are listening right now, the Committee on Health has no active nominations before us for any of the boards and commissions. We have dealt with all of the ones that we have before us, but I know we have lots of vacancies, and we'll talk to some of those boards today where it's a lot more than dentistry. I'm trying to keep myself on a good time because we told the board chairs they would have specific times that they would be up. So I'm going to try to honor that. I will say this. So one, I did introduce legislation about the residency requirement piece to try to get at the fact of getting more people to have an ability to participate. So not that you just have to be a resident, but if you are actively working here, if you're actively licensed here, that so I think open up space. So most people don't realize that only 26% of the licensed dental professionals actually live in the district that we currently have licensed here. And then I've heard from DC Health that a revised health occupations licensing bill is on its way to the council at some point this year. So a larger conversation about the HORA, which might get to some of the other things that you were talking about. But we'll follow up with the board about the subcommittee meetings and seeing what information can get from there. Ms. Reese, Ms. Reese, thank you so much for being here. If you haven't discussed your testimony, if you could do so, that would be fantastic.
Say that again. You said if I can do what with my testimony?
If you can send it to the committee, if you haven't already done so.
Yes, I have. I've done so.
Okay, great. Wonderful. And sorry for the technical challenges earlier getting you on, but I'm glad that we were able to do that. So thank you both for being here. We are now going to transition to talking specifically to some of the boards. The first step is the Board of Marriage and Family Therapy. Give a little bit of background about that. And Sheila Holt, who is the chair of that board, will be joining us. So the Board of Marriage and Family Therapy in the District of Columbia is responsible for regulating the practice of marriage and family therapy. It advises the mayor, enforces laws, evaluates qualifications, recommends standards, issues licenses, and address complaints. The board comprises 5 members appointed by the mayor, including 4 licensed therapists and 1 consumer representative. Good morning, Ms. Holt.
Good morning.
When you are ready, go ahead and present your testimony.
Good morning, Chairwoman Henderson, and members of the Committee on Health and staff. My name is Sheila Holt, and I have the honor of serving as the chair for the District of Columbia Board of Marriage and Family Therapy. On behalf of Mayor Mary Bowser and DC Health Intern Director Keith Fletcher, I appreciate the opportunity to share testimony with the committee here today, and I'm pleased to offer an overview of the Board of Marriage and Family. The Board of Marriage and Family plays a vital role in the District of Columbia's behavioral health ecosystem. Our board is comprised of 5 members appointed by the mayor and 4 marriage and family therapists and 1 consumer member. Together, we regulate the practice of marriage and family. I've had the pleasure of serving as the board chair for the Marriage and Family Therapy Board since 2012. Following my graduation from the University of the District of Columbia with a master's degree in counseling in 1986, I have served residents and visitors in a variety of professional roles. I have provided direct service through several community-based organizations and have operated my own counseling practice since 2011. I have also been employed as an adjunct faculty member for the next generation of behavioral health professionals at both Trinity University and the University of the District of Columbia. My work includes coordinating and providing administrative guidance for clinical and internship experiences for graduate counseling students. In addition to my professional experience, I have been involved with several local professional organizations. I had previously served as president of the DC Mental Health Counselors Association, the DC School Counselors Association, and the DC Counseling Association. Finally, I served as an advisory board member for the University of the District of Columbia Department of Counseling and Psychology. In my role as chair, I work to ensure the board operates in a respectful, efficient, and equitable manner. As of May 24, 2023, there were 200 marriage and family therapists with active licenses. These professionals work in a variety of settings across the District of Columbia, including private practice and government agencies. They are an important part of the behavioral health care workforce, given the unique focus on interpersonal relationships between families and partners. The board has several tools to ensure marriage and family therapists are held to a high standard. This includes requiring licensees to go under continuing education, investigation of complaints of improper or unsafe practice, and when needed, taking disciplinary actions against the licensee. Over the last 4 years, the Board of Marriage and Family Therapy has seen a 36% increase in the number of professionals licensed. This increase highlights the growing need for the behavioral health profession to tackle some of the challenges faced by families in the District of Columbia. The COVID pandemic had a profound impact on parents and children. However, it is also important to acknowledge that many of these behavior challenges existed prior to the pandemic. According to recent survey data, 74% of parents report that the pandemic had a negative impact on their child's mental health. Similarly, 77% of adults reported severe mental health concerns have had an impact on overall family relations. While the COVID-19 pandemic is over, the District of Columbia continues to face with a need for qualified marriage and family therapists to address ongoing challenges. The board has been working on several initiatives to advance the practice of MFT. As a part of the process to update the Health Occupation Revision Act, HORA, the board will undergo organization changes to address board vacancies. These changes to HORA will also clarify telehealth practices for MFT. While the board published a policy document on telehealth several years ago, these changes will provide guidance until regulations can be updated, especially for formal practices. The board also worked to clarify its application requirements to make it simpler for qualified professionals to seek licensure. This includes instituting a waiver for postgraduate supervision hours for people who apply by endorsement and have been licensed for more than 5 years. Finally, the Board of Marriage and Family Therapy is evaluating a regional reciprocity agreement with Maryland and Virginia. This agreement will streamline the process for marriage and family therapists to obtain license in our region. Leadership of the Health Regulation and Licensing Administration met with colleagues from Maryland and Virginia to discuss reciprocity and will update the board and family therapy at future meetings. I look forward to continue to work with my fellow board members of the Marriage and Family Board and to advance the field of MFT in the District of Columbia. I also would like to thank the Committee on Health for their continued support to the district's healthcare workforce, including providing additional funding for licensing specialists in current and future fiscal years. I appreciate your time and this opportunity to testify before the Committee on Health. I look forward to answering any questions you may have at this time.
Thank you so much, Ms. Holt, for being here and for your testimony. I'm the only council member here, so I'm just asking you some questions until maybe perhaps one of my colleagues join me. So can we first start off? There seems to be a lot of boards that are operating in the counseling therapy space. Can you help us differentiate your work from, say, the Board of Professional Counseling or the Board of Social Work? And if you could speak a little bit about, do you all ever collaborate?
The Board of Marriage and Family Therapists function basically on this family systems unit, looking at the individual, partners, and family. The other areas may also do some overlap. However, our primary focus is the family unit.
Okay. Are there any instances where someone would be licensed by multiple boards? So they would be licensed by you all and the Board of Professional Counseling, or is it sort of you pick your lane and that's it?
I do know there is a possibility for multiple licenses, but I can't speak to what the other boards have encountered.
Okay. Do you ever collaborate with those other boards on certain issues? So for instance, I think in your testimony, you talked a little bit about telehealth. I imagine that's an issue that the other boards are also tackling at the same time.
Because of the pandemic, the telehealth came into practice.
Yep.
And we were virtually virtual. So we didn't have opportunities to collaborate on such a trend as telehealth. But we look forward to collaborating and establishing relationships with the other boards.
Okay. You, I think, mentioned in your testimony, and I just want to make sure I heard you correctly, that there were approximately 200 active licensed therapists.
Yes.
Okay.
Right now, our
Go ahead.
status has the 200 is our number, yes.
Okay. Okay, so you spoke a little bit about vacancies, and if you were listening to my back and forth with the public witnesses, although they were for dentistry, I guess I have a similar question for you. Have you heard anything in terms of what's happening with the, I think, 2 licensed therapist positions and then the consumer member position?
I do know that we have had discussion about the vacancies, and there are steps to bring on new members of that. The advertisement of the position for the board vacancies is in an open session agenda. And
Okay.
we have made efforts to have discussions about attending other colleges and universities to either make them aware or further enhance their information about the field of marriage and family therapy.
Okay. Have you had any meetings in 2022 or 2023 to date that have had to be canceled due to lack of quorum?
What we have done was we've scheduled our meetings accordingly to a schedule that supports our members.
Okay.
We avoid cancellations by rescheduling, and the virtual and hybrid method has been most supportive in allowing us not to have to do that.
Okay. In terms of approvals for folks, does the board have to give active consent, or is the HRLA staff able to approve applications where there are no issues, and then the board only reviews applications where there might have been a flag?
The board has worked with the staff. And as you stated, that they are granted authorizations to do some of the work prior to the board. And if those other applications require board interaction, then they are scheduled for meeting to address that.
Do you feel like we need more marriage and family therapists in the district? Are we meeting demand? You said, of course. Well, I'm just not sure. I mean, interestingly enough, my staff and I were talking a little bit about this yesterday. At the mayor's most recent public safety summit, Chief Conti provided some statistics that were a little disarming, particularly around sexual abuse and domestic abuse, and that at the time of the summit, I think we had maybe 76 cases in the district so far this year. And he said only 4 of the cases involved a situation where the persons did not know each other, which elevates sort of this idea that we're seeing a lot more domestic violence. We're seeing a lot more family trauma and tensions. And I'm wondering, if the services of more therapists could help diffuse some of these situations, or help refer folks to further help or counseling if they need it.
Thank you for the discussion. The issues were prevalent prior to the pandemic. And with the pandemic, with the isolation and less opportunity to get out and be amongst other people, there have been reports of increased volume of that issue. There would be a critical need to increase marriage and family therapists to help address some of those issues that you spoke of.
So what specifically can you, or I guess, provide some clarification on the qualifications? So let's say I have a degree in psychology. Are there specific hours I have to do specializing in marriage and family therapy in order to be licensed?
There are allied health professionals that make application for marriage and family therapists. The board and staff then reviews the content of the transcripts and looks at the content courses that relate to the qualifications of a marriage and family therapist, which oftentimes coexist.
Okay. So you guys are doing some deep dives, basically. No, I mean, being honest, right? Like, you're not just looking in terms to see whether or not you got a degree, but how were you trained? What courseworks did you do? And then, looking a little bit more closely, which I think is incredibly important. How many complaints have you all dealt with in the past year?
In this past year, 2023 or 2022? 2020. I'm sorry.
2022, since that's the most full.
2022 is 0.
0 complaints.
2023, 1.
1 complaint. All right. So that's good. In
It's
comparison,
wonderful.
in comparison to some of the others as well.
We're working very hard.
That's good. One of the other things that I've been curious about too, and perhaps this is a larger question for DC Health, but if someone was looking for a licensed marriage or family therapist, do you all keep a roster available? So if somebody came to our office and said, hey, I guess we would call DC Health and say, give us your list, but I have no other way. I guess my better question is, should there be some sort of outward facing directory where members of the public could go and say, this is what I'm looking for, and then find who's licensed here?
Our board does have information about supervision for those persons who need and want supervision. And then there's also a listing of marriage and family therapists. But if I'm understanding you correctly, you're asking for a wider scope of how to support families who may want the services of a marriage and family therapist. And some insurance companies, when clients do use that pathway will have those people in their data bank.
Right. In terms of when you all do surveys and census of the folks who are actively practicing, do you also take note of who takes Medicaid?
I'm not quite aware of the database as such, but most marriage and family therapists will fall in line with the insurance companies and consult with them as to payment plans.
Okay. Okay. I asked a similar question to the board chair for the Board of Psychology, because a lot of their members don't take Medicaid because they've had issues in terms of reimbursement rates and things like that, which have now I'm asking everyone, right? What are the conversations that you're having with the Department of Healthcare Finance if your members are sort of giving the feedback of this isn't working for me from a financial standpoint? Either the reimbursement rate is too low, or the turnaround of payment from the MCOs is such that it's taking 6 months to get paid, and therefore it's not even worth it for us. Do you all get that kind of feedback from your licensed members?
That has not come to the board as of date.
Okay. All right. Let's see. Okay. Were there any significant challenges or obstacles you all faced last year or this year to date as a board operating?
I think as a board operating, we experienced some of the same adjustments that other boards did with looking at COVID, understanding that COVID was not only a district issue, a Northeast corridor issue, but it was a global issue. And so the staff made tremendous efforts to ensure that the board members could do the virtual meetings at all times. And we followed the mayor's directive on that. We are now following directive at looking at hybrid models and in-person meetings.
Okay. Yeah, as we are doing right now.
Yes.
I have one last question. You mentioned some upcoming organizational changes to the board in your testimony to address some vacancy concerns and to clarify the telehealth practices for marriage and family therapists. Can you provide some additional information on this? When you mean organizational changes, what do you mean? Or when you said organizational changes, what do you mean?
The organizational changes that we spoke of would be to get the board back in full function with 5 members. You know, we really would like to do that. And we would also like to encourage DC residents over the age of 18 in good standing with the district that will make application to be on the board as well.
Oh, I see. Okay. All right. So for those who are listening, the consumer member has to be over the age of 18, not be a health professional or in training to become one, may have no household members involved directly or indirectly in providing healthcare.
And be in good standing with the District of Columbia, taxes and revenue.
And have paid your taxes. Got it. Okay. And then for telehealth practices, you said you're going to be issuing some guidance while you work on standards. Is that what I?
We're looking at the license portability issue. So that's still, we were looking at shared portability with Maryland and Virginia, and I'm sure that conversation will come up with new formats and standards and interactions.
Okay. If you just give me just a moment, checking in with my staff to see if they have any other questions. All right. All right. Ms. Holt, thank you so much for
Thank
joining
you.
us today.
It was a pleasure. Thank you.
We are going to go on to our next witness, Victoria Shirk, who is the chair of the Board of Professional Counseling. As they do a switch out over at DC Health, I'll just say a little bit about the Board of Professional Counseling. It is responsible for regulating and regulating the practice of professional counseling. It evaluates qualifications, establishes standards and procedures, issues licenses, and handles complaints within the field. The board consists of 5 members appointed by the mayor, including licensed counselors, an educator, a professional art therapist, and a consumer representative. 1 member must have at least 5 years of experience in addiction counseling. The board's main role is to oversee the practice, maintain standards, and address any pertinent issues. Good morning.
Morning.
All right, you can present your testimony when you're ready.
Okay, thank you. Good morning, Councilwoman Henderson, members of the Committee on Health and staff. My name is Victoria Shirk, and I have the honor of serving as the chair of the District of Columbia Board of Professional Counseling. On behalf of Mayor Muriel Bowser and DC Health Interim Director, Mr. Keith Fletcher, I appreciate the opportunity to share testimony with the committee here today, and I'm pleased to offer an overview of the Board of Professional Counseling. The Board of Professional Counseling works to enhance the practices of professional counseling, addiction counseling, and art therapy by developing and implementing standards and procedures that align with national best practices, reviewing applications, issuing licenses, and conducting complaint interviews and enforcement of disciplinary action when warranted. Through these efforts, the board advances equity and improves population health throughout the district. In addition to serving as chair of the Board of Professional Counseling, I am also a member of the Interprofessional Board Chair Collaboration, a group of 7 DC Health Licensing Board chairs. My fellow board chairs in dentistry, medicine, pharmacy, social work, psychology, and nursing, and I meet with the DC Health leadership on a quarterly basis to advance DC Health's 4th strategic priority, closing the chasm between clinical medicine and public health. Together, we collaborate and learn about public health priorities and the inner workings of DC Health and serve as ambassadors and advocates for advancing population health in the district. I am a licensed professional counselor and have operated my own private practice since early 2022. Prior to that, I worked at several core service agencies in the district as a behavioral health clinician. I've worked in the professional counseling field for roughly 20 years after graduating with a master's degree in counseling from San Francisco State University. I'm a member of the American Counseling Association and am certified through the National Board of Certified Counselors. I began my first term on the Board of Professional Counseling in 2017 and became chair in 2021. The chair for the Board of Professional Counseling fulfills critical responsibilities to ensure the board can perform with a focus on quality, safety, and efficiency. The chair for the Board of Board of Professional Counseling, I coordinate and lead our monthly meetings and ensure that all parties before the board are treated fairly and equitably. The Board of Professional Counseling serves a central role in advancing the behavioral health workforce of the District of Columbia. Through 4 license types, the Board of Professional Counseling oversees 2,200 dedicated behavioral health professionals. The Board of Professional Counseling and its staff work diligently to ensure both the public and its licensees are kept safe. The board also ensures that its licensed professionals keep up to date with best practices of their profession and are aware of emerging behavioral health issues through continuing education. The Board of Professional Counseling investigates and, when appropriate, takes disciplinary action to correct any complaint patients make about any of the 4 professions regulated under its authority. This can include a notice of intent to discipline, suspension, or revocation of a license. Staff and Board of Professional Counseling members work diligently year-round to ensure that professionals receive their licenses in a timely manner. As of May 2023, the Board of Professional Counseling oversaw the licenses of 375 graduate professional counselors, 1,604 professional counselors, 86 addiction counselor 1s, 147 addiction counselor 2s. Since 2019, the number of professional counseling professionals licensed by the board has increased by 19%. This increase in the professional counseling workforce supply is needed given the increased behavioral health needs of the community. However, the Board of Professional Counseling continues to evaluate strategies to make professional counseling and addiction counselor professions more accessible to aspiring professionals from diverse backgrounds to meet this growth in demand for behavioral health services. Professional counselors and addiction counselors play a critical role in ensuring behavioral health services are available to those in crisis. In partnership with our other behavioral and physical health partners, we collaborate and work directly with people in individual and group settings to identify problems and develop solutions to challenges in their lives. Over recent years, the role of counselors and addiction counselors has become more integral to the district as board licensed professional services have been in greater demand due to the impact of the pandemic on mental health and the continued opioid crisis. As board chair, I'm committed to continuing to focus on identifying new and innovative strategies to advance the counseling profession. The Board of Professional Counseling is continuing to work to expand the number of professional counselors and addiction counselors for the district's growing behavioral healthcare workforce needs. This includes presentations by board staff to organizations such as Catholic Charities who train addiction counselors. The board plans to increase this outreach to professional counseling schools in the region next year, both to increase interest in the profession as well to prepare students to successfully become licensed. The board is also exploring outreach to local high schools to drive more interest in these critical professions earlier in life and create pathways for our young people into meaningful careers. These efforts are an important step to strengthening and continually improving the standards for the district's behavioral health workforce. In addition, we will soon begin to license professional art therapists. The implementing regulation was published as proposed rulemaking in April 7th, 2023, and will soon be published as final. I note that I am the sole member of the Board of Professional Counseling at this time and would like to take this opportunity to publicly ask any of my colleagues who are interested to please join me by applying with the Mayor's Office of Talent and Appointments. In the upcoming Health Occupations Revision Act update by DC Health, there will be a consolidation of boards. There is still a need for more professional counselors and addiction counselors to help oversee and support our professions. I look forward to continuing my work with the board staff, licensees, and our partners to advance the field of professional counseling in the District of Columbia. I would also like to thank the Committee on Health for their continued support of the district's healthcare workforce, including additional funding for licensing specialists in the next fiscal year. I appreciate your time and this opportunity to testify before the Committee on Health. I look forward to any questions you may have for me at this time.
Thank you. Thank you for your testimony. Thank you for being here. I do have some questions. All right, let's start.
Yes.
Can you confirm the actual number of seats on the board? We have one source that says 5. We have another source that says 6, all in the same part of the code. How many people should there be on the board?
But I would tell you 5, but I would of course defer to staff. They are my, yes. I'm confirming 5.
5. Okay. All right. When we do the HORA update, we will clarify.
We have not been fully staffed, I think, almost the whole time I have been on the board, sadly.
Wait, you've I pulled up your stuff yesterday. I think you've been on the board since like
2017. Maybe at the very beginning. There were 1, 2, 3, 4, 5. I think there was a brief period where we had 5, maybe.
Yeah. Well,
Check
I know last council period, there were at least 3 nominations that were approved. And I guess those individuals have either withdrawn or whatnot. Many of them had terms that continued on. My understanding, though, is that your term expires in July. Are you intending to go for a reappointment?
Yeah. I enjoy my role and I take it seriously, I feel.
Okay,
It's
great.
important
So
service.
Moda, if you can please send Ms. Shirk's nomination materials, we will most certainly get that done. Okay. So it appears that the board, it does cover a wide range of licenses. And similar question to what I asked Ms. Holt earlier, can you explain a little bit more how you all differentiate in terms of whether or not someone is qualified for a license with the Board of Professional Counseling versus, say, the Board of Social Work or the Board of Psychology or the Board of Marriage and Family Therapists? What specifically are you guys looking for in their fields of study to say that they're qualified for professional counseling?
It depends, of course, on which license type we're talking about of the ones that we cover. The primary thing is the education, is
Okay.
that, let's just start with the LGPC, LPC, is that they must have a Master's of Science.
Sorry, break down that acronym. What does that mean?
I'm sorry. Licensed professional counselors and licensed graduate professional counselors
Okay.
must have a master's in counseling. And sometimes that's referred to as counseling psychology.
Okay.
And then the certified addiction counselors, 1 must have an associate's degree in a science-related field, and certified addiction counselors, 2 must have a bachelor's degree. Licensed art therapists must also have a master's in a counseling degree. They typically have additional coursework, obviously, that reflects their
Art background.
studies. Yes. My understanding, I don't know if you asked this specifically, but marriage and family therapists, I believe, have different requirements, slightly different requirements for supervision. Licensed professional counselors are required to be supervised during their licensed graduate years. These are the 2 years that they do where they accumulate hours of experience to make them appropriate for full licensure. They must be supervised by a licensed professional counselor for at least half the time, and then they may be supervised by a psychologist, a psychiatrist, a social worker. I don't think I'm missing anybody else. Yes, I'm sure.
Okay.
I believe the marriage and family therapists have an additional, I don't think we have marriage and family therapy as accepted supervisors. So I think that's the primary difference between marriage and family therapists and licensed professional counselors.
Okay, so just a clarification, could someone potentially get supervision while they're in school?
They are required to have what's called a practicum. So while they're their master's degree, they do gain experience while having direct supervision on site and within their program.
Okay, got it. You're in the room with staff, and I know DC Health folks are listening in. So if somebody can send us over the nice little chart that you usually do, census breakdowns of each of the license types and how many folks in each. Ms. Shirk, so folks, obviously addiction counselors would, well, no, I'm not going to make any assumptions. What settings are most of the folks operating in? Is it private practice or hospitals, nonprofits, community centers, et cetera?
I don't know how much data we have on that. In my experience, it's that the majority are working in core service agencies in the district and also in addiction programs in the district.
Okay, which I think it's given what we are facing in the district right now from overdose standpoint and just sort of dealing with opioids, et cetera, I think this is super important.
Yes.
And I will also say this, at least from the data that we have, I think it's commendable that we've seen a 36% increase in the number of licensed professionals over the past 4 years in this field, because I think it's showing that people are wanting to go into the field, but also are going to show up for their neighbors who are clearly in need of help.
Yeah, it's a great opportunity for people also who are in recovery and want to give back. We know that kind of peer relationship is some of the most effective in terms of treating addiction. So the CAC license is very important. They're really instrumental in providing addiction services in the city.
Okay. What do you think has contributed to the increase of people wanting to go into this field?
I think it may be the increase in opportunities that has happened around telehealth. Believe it or not, there are now all these companies, many of which you hear on the radio, and so that people can work remotely in the profession, and the compensation, it's depending on where it is, but the compensation is pretty good, and they don't need to leave home. There are these sort of national companies that are pursuing licensed individuals. And I think that there's more opportunity easily accessible for work than there was previously.
Well, I think it's been great in terms of accessibility, but nationwide has also opened up some issues, especially around privacy concerns, et cetera. And we are dealing with, we have a bill that is in a committee around telehealth. I think that hearing is in a couple of weeks. I'm sure my staff will tell me when it is. And we'd love to get some feedback from some of the boards. This is for DC Health, not just for you.
Yeah.
DC Health staff, if you're listening, because I think it's super important. And the hearing is on June 6th. Nope, July 6th. So I guess my question for you, I know you're a board of one, but how are you thinking about the telehealth issue? On the one hand, it's growing.
Yeah,
the accessibility, but on the other hand, is something being lost from not having the physical face-to-face?
I would say it is majority positive. It has increased access significantly, particularly when I was working for core service agencies, clients who might be reluctant or have difficulty showing up for an appointment consistently were able to engage and be consistent via telehealth. I think that people who their work schedules wouldn't usually allow them to take off for 2 hours to go see their therapist are able to engage. So I think the increase in access has been terrific. I think that it has brought up, I think that having a more clear training pathway that be required CEUs, be that, certification would be one extreme end, CEUs would be sort of a more minor end. Some kind of training so that clinicians are clearly aware of their where they are licensed to practice and where they are not. Standards of practice around telehealth, like making sure you know the location of your client in case there's a crisis, things like that. I think there could be a fine tuning or an increase in training. But I think overall, telehealth has been a real boon to profession. And in my experience as a clinician, it is, I'd say, I would rather be in an office with someone, but I think it is fully effective.
Okay.
And I do telehealth 100% of the time currently. So
I see. Okay. Are there currently any applications that are backlog in terms of approvals for the board?
no, when an application is delayed, it's typically because an issue has been, the staff has become aware of an issue with the application. It's often around supervision or concerns about, we call it unlicensed practice, but typically it's a lack of understanding about the requirements. And then the board needs to review it. Of course, we only meet once a month. And then sometimes investigation is required. That's not very common, but it does happen. And that can slow an application's progress. But otherwise, we're moving quite quickly this year, even
Okay.
compared to last year.
Well, can you help me understand how then the board has been operating since you're the only member?
So we don't have an
Like,
issue.
how do you take action? You don't have quorum.
Sure. First of all, it's obviously not ideal because I like to consult, and I'm very fortunate in that staff is very experienced. We have our board attorney. So I have lots of people on hand. It's me and 5 other staff at each meeting. So I'm not there by myself.
That's nice.
Yeah. Oh, boy, is it. And I do believe that my experience is diverse, which is lucky. So I think the main experience I'm missing is that there's usually an education member, somebody who's a professor. Dr. Sardi had to leave the board. She was our education person. But besides that, I think I have really varied experience that allows me to do as best as I can in that situation. But it's not ideal. It's not ideal.
Well, I mean, I think you said you're adding art therapy. Are you a?
Yes. No, I'm not. So we are not officially doing that yet. Like I said, I think the period of review is almost over, but not quite there. But we will be looking for an art therapist member. I do think we have a members maybe coming in the fall. I understand.
Okay.
And we're all, I'm talking to colleagues. I know staff is working hard. I call MOTA independently and say, any news, any progress? So we're really anxious to have more voices on the board, without a doubt, but I'm doing my best. Meantime.
And maybe this is not a question for you. Maybe this is a question for DC Health, but I know, so I chair the health committee. There are 5 members of my committee. I can't take action on a piece of legislation by myself. So I'm struggling to understand how you are taking action on complaints or applications by yourself legally.
Right. And I would defer that to our board attorney. And I think that they can send you the legalese, as I would say, about how that works out, because I had the same question. But
Okay.
we do have
All
quorum,
right.
and that's what's required to proceed. But I don't have the legal background to explain that to you. But it will be provided, I'm sure.
Okay. I think I was on a call with her once, the board attorney. So
Terrific.
send that over, because I'm sure I have questions, and I know that some other folks have questions as well.
I'm sure.
Hold on one second. Okay, how many complaints did you all have in 2022 that you all dealt with?
In 2022, we had here, 2022, we had 3 complaints. 1 resulted in investigation being requested. In 2023, we've had no complaints. We did ourselves request 2 investigations, however. that was in circumstances which I described, where sometimes some of the supervision is unclear or their experience is unclear, so we investigate.
When you all, I imagine you have this maybe perhaps or not, do you all have data on the number of licensed professionals by race or excuse me, by race, ethnicity, or gender?
You know, I believe that we do. I don't know that it's in my briefing packet, but when I was meeting with staff prior, I believe that we do. I don't think we have it by, well, we may have it by, yeah, we can get it. I know that we discussed it in preparation for this testimony.
All right, that would be helpful to understand.
Yeah.
So as you sort of mentioned in your testimony, a number of the professionals who are licensed under your board are sort of dealing with addiction and counseling issues from there. So with that, to what extent do you all collaborate with the Department of Behavioral Health?
You know, that's a kind of a tricky question for me because I professionally have lived in that world for the majority of my career. I think that my understanding, and staff should really speak to it, is that the Department of Health has over the years coordinated with them here and there.
Okay.
I think more coordination is always better than less, because there's so much overlap, and so.
Well, not only just that, but there's a lot that's going on in the opioid space. So for instance, right now we're trying to set up the Opioid Abatement Commission, which is going to be making some decisions on how to spend a lot of money. I feel like there are professionals in your field who probably have some expertise and guidance to be able to offer for that commission. Or the district is about to open up its sobering and stabilization centers. Again, I feel like there is some collaboration and work there. It seems to it is wild to me, but it also seems to me that we are operating in silos, even though the licensing is happening here, but the programmatic work is happening in a different agency, and I'm not seeing the intersections in a way that I feel like would better help residents.
Yes, and I think it's also important to note, you asked earlier when speaking with my colleague on the marriage, the chairperson of the Marriage and Family Board. I mean, those agencies are who are providing services to residents with Medicaid and Medicare. That's where those services are most readily available for those residents. So even more reason to be carefully collaborating. And I also think that those agencies, the core service agencies, like any organization, think carefully and are constantly trying to keep up with licensing requirements. And that can be difficult with their staffing needs. They run into all kinds of challenges. So I do think more coordination is good, but I'm again, that's not over my level.
Well, I would say that one area though, in particular, when we were talking about complaints is, so the Department of Behavioral Health licensed the facilities, and we get lots of complaints about facilities. There are several investigations going on about facilities, and it's facilities, but there are also people, licensed professionals who are part of it. And one of the things, and we could follow up with DBH about this separately, is one of the questions I have is if there is a substantiated claim from a complaint about a facility, do they forward that information to the licensing board so that you all can take action if there's something going on?
So no, they don't. The way it would come to our attention is if is typically around supervision, is about somebody's application process. And then we may become aware that somebody is working without licensure or without proper supervision. And then the investigators would go to that core service agency, figure out what kind of efforts are being made and then communicate with the agency in that way. But we work only with licensees, not with organizations, if that makes any sense.
No, I understand that. Let's say, for instance, the Board of Medicine, if there is a doctor who has a complaint against them who've already been licensed by the district, the Board of Medicine would then take action against them. Would that not be the same for you all?
Yes, it is the same.
Okay. So that's what I'm sort of saying is that if the Department of Behavioral Health is doing these investigations, and if there are, in fact, substantiating some of those claims, they should be forwarding that information on to HRLA as well, so that you guys aren't left in the dark about what has been happening in the facility.
Well, and I'm not entirely sure what the investigations involve. I mean, not knowing that, it's hard to know if it would be pertinent to the board specifically, because again, our mission is quite narrow in terms of protecting DC both licensees and the residents. So, but we don't address organizations. So if it's an issue of whether they're appropriately using licensed professionals and an individual came up, they would be wise to say this person who said they were an LPC, has not, I think it is unlikely that they would pass on to us. Department of Behavioral Health might choose to do that, but I think it's unlikely that the core service agency would send one of their employees directly.
I would say that the core service agency wouldn't, but I would certainly expect for the DBH would.
That would make sense to me too.
But we could dig into that more, because I'm just, again, it's
Very
about protecting patients, right? And so if you've been flagged over here, we've been having this issue in the transportation, right? If you've been flagged at Superior Court for a DUI, then DMV needs to take action.
Right.
If they aren't, that's a problem. So if you've been flagged over at DBH for a problem, and then your licensing board is not taking action, that's a problem. So we got to work on opening up these lines of communication. But I want to ask you about some legislation. So you mentioned in your testimony about a HORA update that a consolidation of boards. This was news for me. I don't know if you were breaking some news, because we haven't seen it yet. So do you have some insight that you can share, or are you going to tell me that I have to wait?
I don't know the details. I think staff is exploring it because there are, obviously, there are similarities. I came out of California where the standard, there is no licensed professional counselor. There's only a marriage and family therapist. So as we've already discussed, there are some differences, but it may be that there's enough overlap that it makes sense to combine. But again, I think staff can speak to that better than I can, but I think it's being considered. And also with the department is doing its best with the resources it has. So I imagine that might be helpful for their staff workload.
Okay. So as you may know, the Counseling Compact Approval Act of 2023 was recently introduced. What's your initial reaction to the bill's proposal to establish a counseling compact within the region?
Well, I have my opinion as a DC resident who is a professional counselor, and I have my opinion as a board member.
Okay.
As a DC resident who is a professional counselor, it overall is something that would be great for the profession. There are concerns that I share from a regulatory perspective, particularly in lieu of the Dobbs decision, that there may be confusion between jurisdictions. The district has been terrifically clear, if I may say, where we stand on that issue. But if somebody from a jurisdiction that did not have the same laws and regulations in place came to practice in the district, or vice versa, we want to make sure that there are no issues. So I think that is what DC Health is exploring right now before it feels like it can state whether it supports the compact or not.
Got it. Are there other compacts that you're aware of in this particular field? Like, so for instance, with nurses, there's a National Nurse Compact. I think there's a Psych Pack, so dealing specifically with psychology. Do any other jurisdictions have a counseling compact?
I cannot say for sure. I believe there is one other in a different area of the country, but this I think is growing to be the largest compact so far. I mean, it has been established. I think 14 states at least have joined it.
Okay.
And primarily, I think along the Eastern Seaboard, somewhat into the center of the country. But there may be, I think, one other, but this is the largest so far.
Okay. Awesome. Okay. Is there anything else you wanted to mention that I haven't asked you or you haven't been able to say?
I don't think so. Again, we'd like more. I think that
You want colleagues.
More board members, please. And I understand the struggles around issues around residency and issues around not having a prior or current relationship with the DC government, and that these are all important things to pay attention to, but they can also be barriers to board membership. So I hope that people be considering where flexibility can be brought in to make it easier to be a board member.
Okay. So this is going to be my PSA. We are looking for 2 professional counselors who are licensed in the district, 1 educator, 1 art therapist, and a consumer member who has to be over the age of 18 years old. So if this is you and you want to serve your city, apply. All right, Ms. Shirk, thank you so much.
Thank you, Councilmember
For
Henderson.
being here, and look forward to continuing to work with you. We are now going to move on to the Board of Dentistry. We have Dr. Iris Jeffries Morton, who is the Vice Chair of the Board of Dentistry. As she transitions, I'm going to say a little bit about the board. So the DC Board of Dentistry regulates the practice of dentistry and dental hygiene in the district. It evaluates qualifications, administers exams, and recommends standards and procedures. Moreover, the board issues licenses, receives and reviews complaints, requests investigation, conducts hearings, and issues an annual report. The board consists of 7 district residents appointed by the mayor with the advice and consent of the council, including 5 licensed dentists, 1 dental hygienist, and 1 consumer professional. Dr. Jeffries Morton, how are you?
I'm great, thank you for asking.
And
Good
you can
morning.
go on with
Hey.
this.
Okay, good morning, Chairwoman Henderson, members of the Committee on Health and staff. My name is Dr. Iris Jeffries Morton, and I have the honor of serving as Vice Chair for the District of Columbia Board of Dentistry. On behalf of Mayor Muriel Bowser, DC Health Interim Director, Mr. Keith Fletcher, and Board of Dentistry Chair, Dr. John R. Bailey, I appreciate the opportunity to share testimony with the committee here today, and I am pleased to offer an overview of the Board of Dentistry. The Board of Dentistry regulates the practice of dentistry and dental hygiene in the district. The board oversees dental professionals and makes sure they are held to a high standard as part of the district's overall healthcare workforce. Additionally, the Board of Dentistry is committed to ensuring all district residents have access to quality dental care and to advance oral health outcomes for the District of Columbia. My colleague, Chair Bailey, is a member of the Intro-Professional Board Chair Collaboration, a group of 7 DC Health licensing board chairs. The board chairs for dentistry, medicine, nursing, pharmacy, social work, psychology, and professional counseling meet with the DC Health leadership on a quarterly basis to advance DC's health's 4th strategic priority, closing the chasm between clinical medicine and public health. They collaborate and learn about public health priorities and the inner workings of DC Health, and serve as ambassadors and advocates for advancing population health in the district. I have served on the Board of Dentistry since 2017 and as Vice Chair since 2023. In addition to my service on the board, I have been active in the dental field for over 40 years. I graduated with a doctorate of surgery from Howard University College of Dentistry in 1977, and then served my residency at St. Elizabeth's Hospital. I have operated my own dental practice where I served more than 2,500 patients annually. I have served as a dental professional for various government agencies, including the Department of Health and Human Services, the Department of Veterans Affairs, and the District of Columbia Department of Health. Most recently, I was an associate professor and interim chairman of the Department of Diagnostic Services at Howard University College of Dentistry, retiring last year as an emeritus professor. Throughout my career, I've had the honor of being recognized for my work and academic contributions, including receiving the Howard University College of Dentistry Alumni Award, inducted into the International College of Dentistry, receiving the Howard University College of Dentistry Distinguished Faculty Award, and most important to me, receiving the Outstanding Teacher Award. This is done by the students. Finally, outside of my professional experience, I've served as a board examiner for the Commission on Dental Competency Assessments, that CDCA. I still do board exams, and as a member of the American Dental Association and the American Dental Education Association. The Board of Dentistry serves a key role by advising DC Health and administering and enforcing the law. The board consists of 7 district residents appointed by the mayor with the advice and consent of council. 5 licensed dentists, 1 licensed dental hygienist, and 1 consumer member. As vice chair of the board, I work closely with the board chair and staff to achieve the mission and overall goals of the board. My fellow board members and I evaluate qualification standards for our licensed dental professions and ensure that applicants are adhering to them. The Board of Dentistry issues 6 different license types and is responsible for reviewing complaints and conducting disciplinary hearings when needed. Staff and Board of Dentistry members work throughout the year to make sure applications for dental licensures are processed in a timely manner. As of May 17th, 2023, active licenses of the Board of Dentistry included 1,280 dentists, 535 dental hygienists, 137 dental assistants, level 1, 560 dental assistants, level 2, 2 teaching licenses for dentists, and 1 teaching license for dental hygienists. These professionals serve district residents and visitors across a variety of settings, including federally qualified health centers, private clinics, hospitals, and schools. People who are unable to manage their oral health through regular access to a dental professional are more likely to develop endocarditis, pneumonia, cardiovascular disease, and complications with pregnancy or birth. The dental profession has faced significant challenges over the past several years. Since 2019, in the district, there has been a 21% decrease in overall licensed dental professionals, which includes a 30% decrease in licensed dental assistants. Nationally, the American Dental Association found that 31.4% of dental hygienists nationwide are expected to retire within the next 5 years. As more dental professionals retire, there are not enough people joining the workforce to take their place. Nationally, between 2018 and 2022, there has been a 7% decrease in graduates for dental hygiene and a 20.6% decrease in graduates for dental assistant. While many of these challenges existed before the pandemic, COVID-19 has had an extremely disruptive effect on dental care. Survey data showed that at the start of the COVID-19 pandemic in March of 2020, 76% of dental offices were closed for anything but emergency care. The combination of these workforce and access challenges led to less people seeking dental care within the district. For our most vulnerable population who have Medicaid, 24% fewer regularly enrolled youth ages 1 through 20 received preventive dental care in fiscal year 2022 as compared to fiscal year 2019. As it is with other parts of the healthcare system, access to dental care is unevenly distributed across the district. Among preventive dental care access points in the district, only 15% are in wards 5, 7, or 8 and serve low-income residents. This has resulted in dental care outcome inequities. Black residents are 13.7% less likely to have accessed dental care within the past year as compared to white residents. Similarly, Black residents are 3.2 times more likely to have experienced tooth loss due to tooth decay or gum disease as compared to white residents. As board co-chair, I am committed to continuing to focus on those important issues and to collaborate with district stakeholders to identify innovative and equitable solutions. My fellow board members and I have worked on several initiatives over the past year to advance the dental profession in the district. This includes clarifying the examination requirements for dental professionals. The board requires that applicants pass the American Board of Dental Examiners exam. While there are other exams available, the Board of Dentistry wants to ensure that first-time licensees are held to a higher level of accountability and integrity as they seek to enter the dental profession in the district. This includes enhanced technology offered by ADEX that more accurately simulate what a professional would find when serving a patient. The Board of Dentistry has also changed the scope of practice for dental hygienists and dental assistants. This includes developing a dental assistant level 3 license that offers assistants greater opportunities for independence. Additionally, the board is creating levels of supervision for dental hygienists and assistants that allow dentists to be more efficient with their limited time. Given existing workforce challenges, these changes will increase access to dental care as existing providers would have increased capacity as dentists' supervisory burdens will be decreased. The board is also more closely regulating the following: the practice of advertising as a specialist or specialty without the appropriate training and certification. This will ensure that practitioners are advertising within their scope of practice. Developing a sedation and anesthesia certification for dental offices who provide this service. This will enhance the safety of the patient. Clarifying regulations relating to unlicensed individuals owning and managing dental offices using employed licensed dentists as the owners. These changes will hold licensed dental professionals accountable by ensuring that they only practice in offices or facilities owned by the district licensed dentists per statute. Much like other healthcare professional licensing boards in the district, the Board of Dentistry is working on a reciprocal agreement with Maryland. This will expedite the process by which dental professionals could enter the district while ensuring there's appropriate oversight and accountability. The board is also working with the Office of the State Superintendent of Education, OSSE, to develop guidelines and requirements for potential dental assistant schools in the district. These efforts should have a positive impact on the district's dental workforce, both short and long term. I look forward to continuing to work with my fellow Board of Dentistry members to advance the field of dentistry in the District of Columbia. I also would like to thank the Committee on Health for their continued support of the district's healthcare workforce, including additional funding for licensing specialists in fiscal year 2023. I appreciate your time and this opportunity to testify before the Committee on Health. I look forward to any questions you might have for me at this time.
Thank you, Dr. Jeffries Morton, for that very helpful testimony. I actually even had to ask my staff to send it to me because you had some statistics in here that I think people need to hear and definitely understand when we talk about equitable access, but also dental care very much being part of healthcare. And people kind of think of this as like an aside, perhaps partly because the insurance companies don't often cover dental care as part of just general health insurance. You have to get a separate plan for the dental pieces. But I just want to call out some of the statistics that you said. For our most vulnerable youth who have Medicaid, 24% fewer regularly enrolled youth receive prenatal dental care in FY22 as compared to FY2019, which means that we have some work to do on our end, but I do have some questions for you. Okay, so
May I speak to that point?
oh, sure, yes, ma'am.
As you know, that was during the area of the pandemic. And dental offices were highlighted for having a spread of COVID because of the aerosols. So people were more concerned about receiving dental care. And at that time, we didn't have equipment in every office that covered the aerosols and the protection, not only of the dentist, the flow of aerosols from the patient's mouth to the dentist and to the assistants. But since that time, that equipment has been made available, and that aerosol production has been addressed. So I would say, due in part, that was because of the fear and concern of the patient, unless there was an emergency situation.
I definitely would agree with that. I think I'm sort of thinking of, in the similar vein, we saw lots of numbers go down around preventative care during COVID.
Sure.
How do we rebound our numbers to pre-COVID? Which is going to, I think, require some intentionality on our part to make sure that folks get back in for those 6-month visits, the cleanings, the exams, and things like that.
As I talk to my colleagues throughout the district, Maryland and Virginia, most of those in private practice are stating that they are seeing their patients returning at a normal rate.
But this conversation is a great reminder for me that I need to schedule my appointment as well. But let's get into some questions about the work of the board. How many vacancies do you guys currently have on your board?
We currently have 2 vacancies, one for a dentist and one for a dental hygienist.
Okay, and are you aware of any efforts on the part of the Mayor's Office of Talent and Appointments to recruit folks for those positions?
I'm aware of what we do as the board. Monthly, our executive director pleads in public session that interested applicants apply through MOTA. And
Okay.
she has been doing this consistently for the past year and a half.
Okay.
So we put it out there, we talk to colleagues, we try to get colleagues to apply. We realize that many times our colleagues who are in private practice, this is a day from work that they have to take. And then the things we do throughout the month, we're giving actually more time than that one day a week as volunteers.
Right. But it's
So
super,
we are actively looking for new members.
yes. So I'm not sure if you're aware, but I introduced legislation, I think it was a week ago. The days are running together, but it's to address some of the barriers that we've heard of from some other boards around the particular residency requirement. So the information I have is that about 26% of licensed professionals under your board are district residents, which in my opinion is a smaller pool of people to pull from, whereas you might have lots of folks who have been practicing in the district who want to serve but aren't given that opportunity. Is that something that you're hearing from colleagues of, I've been working here for 15 years, I would love to serve on the board, but I don't live here?
I have not heard that on a large scale.
Okay.
No, I have not heard that.
Okay. Do you think that this might help in the recruitment process?
I think that it could help, but I think they should be appointed to the board with various considerations.
Correct.
You should have some allegiance to the District of Columbia and the District of Columbia citizens, other than just owning a business. And I'm speaking now, not for the board, but
For
personally.
yourself. No, I agree with you on that front.
I've lived in the District of Columbia since 1961. My office was in Maryland. I could have easily served on this board because I live here, I pay taxes here, I've raised a family here, I've been an active member of the district community. So I'm very concerned about what happens to the citizens here in the District of Columbia. I think too that it would help if that person at least owned the business and has been affiliated with the district for a period of time. Again, this is a personal observation and not one that the board has supported or discussed.
Well, I'm asking you as someone who's practiced in this field for a very long time. So I appreciate your feedback on that. How many DC health staff has been, I guess, appointed to help with the board's work?
We have, of course, there's our executive director who helps all the time, and there are two licensed specialists.
Okay.
Two as of fiscal year 2023. For years, we operated with one
Okay.
full-time employee.
I understand that you all are getting ready to do renewals. Is there plans to detail more licensed specialists to help with that work?
I couldn't address that. I don't know the answer to that question.
Okay.
That would be helpful. I'll throw it out there. But we will follow up with you on that.
Okay. Okay. I guess in sort of understanding the operations for approvals or of new applications or renewals, does the dentistry board approve everyone, or does the executive director have the power to approve some folks and then the board approves those who have additional questions or concerns?
That is how it operates. The licensing staff reviews the applications. If there are no issues, the executive director can approve can make the approval. If there are questions that need to be brought to the board's attention, those are sent to us. However, the board members are actively involved in that approval, and we get applications every week.
Every week.
Every week I am reviewing applications.
Okay. So I'm going to maybe regret saying this as part of my PSA to get more people, but what's the time commitment? Or for a non-chair member?
For a non-chair member, and I serve on the committee of credentialing and audits. You really want to hear it?
I feel like we need to,
Do you really want to know how much time this volunteer has to put in and how much time I have put in this week?
I feel
Well,
like we need to be honest with people about what we're talking about here, but I think it also helps to provide information around the work of the board, right? I think for some people, they just feel as though, you know, you guys only come in once a month and do the job and you're not doing anything else. I think this
Oh,
is
no.
helpful.
Oh, no. And I'm glad you asked that question. On a monthly basis, when we have meetings, we are given the the agenda along with the other information that we need to make us decisions. That comes to us probably 7 days, 5 to 7 days in advance, with amendments made as needed. On an average, it takes me at least 12 hours to review all of that information. Mind you, Madam Chair, we are reviewing complaints and other issues that our licensees might have, along with issues that they might have once they have submitted their applications that we have to verify. So I would say for that monthly meeting alone, it would take me about 12 hours to review all of that information. It would take me again, and we do have virtual meetings, some in-house, some virtual, which has been good. But then to come here, that's another full day.
Mm-hmm.
Being on the audits and credentialing committee, as I said, there's several of us who review applications every week. And I would say that's about 5 to 7 hours per week. Mind you, when I was working, I did that in the evening.
Okay. No, like I said, I think this is helpful.
Yeah.
I'm all about, yes, we want people to do this, but I want folks to I want to be honest with individuals so they understand what the commitment is, but that they have a full understanding of the work and scope that you all do. So let me ask this, similar to what I asked your other colleagues earlier. How many complaints or disciplinary actions did you all hear in 2022?
In 2022, the Board of Dentistry received 16 complaints, of which 11 resulted in investigations being requested.
Okay.
And fiscal, you want to hear about 2023?
Yes, ma'am.
Okay. Thus far, the board has received 27 complaints, of which 17 resulted in investigations being requested.
All right. Things are moving in FY23.
I would say so.
Okay. So I want to ask about some of the things that came up in the public testimony around the licensing piece, and maybe you have some insight into this. So I'm not sure if you heard from Kurt Gallagher from the Dental Society. He raised some concerns around the requirement of licensure for a level 1 dental assistant. Do you have some insight into why you all decided to require a licensure for that position when Maryland and Virginia do not?
I certainly do.
Okay.
Simply because for a level 1 dental assistant, there's minimal educational requirements. That minimal being a high school diploma or a GED. And why do we require that? Simply because we are looking at our regulations in terms of providing less oversight and direct supervision of all levels of dental assistants. So the things that are within the scope of practice with level 1 dental assistants, we want to make sure that they are capable of carrying out those jobs. So as compared to Maryland and Virginia, level 1 dental assistants, excuse my voice, I am asthmatic, level 1 dental assistants have to have total supervision.
Understood. Okay. Do you feel like this requirement in any way puts us or puts our dental offices at a disadvantage for recruiting people since we require this, but the other jurisdictions don't?
I think maybe in having practiced in Maryland, I'm very familiar with their regulations. For example, all dental assistants in Maryland who are going to take radiographs have to pass a radiation examination, and they are licensed as radiation technicians. We don't require that, okay? So I think what puts, I don't think that puts us as at a disadvantage for those people who would like to practice here. Maybe, and I did not check this, I cannot say it accurately, maybe the cost of them registering might be a problem. As Kurt noted, it's a $200 some cost with a $50 CBC check. I can assure you, Madam Chair, from a personal perspective alone, those CBC checks are very much needed.
Okay.
Those CBC checks reveal things that of interest to us in protecting the public.
Understood. So on that front, if you need a moment to get some water, just let me know.
I just need some water. Thank you.
Okay. I guess on that, I wanted to follow up on the background check piece. Another thing that Kurt mentioned was that background checks are going to be required for all renewals. Is this for, well, and I don't know if you would necessarily know this, is this for all of the boards, or is this just something specifically that the Board of Dentistry is now adding in?
This is for all of the boards. It's not
Okay.
specific to just the Board of Dentistry.
Got it. Okay. Give me just a second. So I appreciate your testimony, and I'm just going to highlight this for the DC Health staff because it was very detailed with citations, et cetera. And one of the things that you had in here, which we were going to ask Herla for all of them, was this very detailed and informative workforce survey fact sheet, but it was from 2017. I'm curious if you all have more updated information. I'd imagine you do. How often do you all do it?
We need to follow. We need to follow up with. I need to follow up with you on that question.
Okay. I guess my full question would be, how often do you all do workforce surveys?
We do workforce surveys at every renewal period, and licenses are renewed every 2 years.
Got it. All right. So we would have one coming up. It's lots of great information, where people are, how many gender, race, some of these questions I've been asking. So Herla staff, get ready.
Okay.
It's quite nice. One of the questions that I do have as sort of coming out of your testimony, you mentioned in terms of where folks in the city have access, as in you have a provider in your ward, and wards 5, 7, and 8 don't really have the same number of providers who are there. And this is not something that we just have on dentistry. I can say that about several other health professionals, where in the district, a lot of our health professional offices are clustered downtown. are clustered in the center part of the city. Are there things that the district can be doing better to entice more providers to want to set up shop in other parts of the city?
From a board perspective, we are trying to work collaboratively with other healthcare professionals to see how we can improve this access to care. From a personal perspective, as a DC citizen, I would say that you could encourage more providers by locating public health clinics in those areas. If I look back some years ago, public health clinics were located throughout wards 7, 8, and 5. This is personal to me because my husband supervised those clinics many years ago. We found that that was very effective in providing access to care to the citizens. If you go back in the 60s and 70s, again, this is not board stuff, this is Iris Morton speaking. There were clinics within the schools. And one of my jobs before going into private practice is I worked at one of those dental school clinics. And I found those very accessible to the citizens and to the citizens of those wards.
I've definitely heard that and would certainly agree. I know that some of our school-based health clinics that are part of DC Health do provide dentistry, but a lot of people don't necessarily know that they exist and that this is an option for them. And, you know, I think this has also been a challenge too around how do we get more providers to even come into the schools to help ensure that kids are getting checked to make sure that they don't have any serious issues and the cleanliness and things. One last question I wanted to ask. So you mentioned there's several committees that meet in between your monthly meetings, et cetera. Is there a particular reason why those meetings shouldn't be public beyond credential and the one who is dealing with investigations or complaints?
Those meetings, the committees meet and make recommendations, and we give a report at every monthly meeting. And before anything is put into regulations, it is put out there for the public to review for, I think it's for 60 to 90 days, for 30 days. It is on the website. Anybody can review it and comment. Our executive director makes that perfectly clear at every meeting. We are not trying to silence or silo the community at all. It is just if things are brought to our attention, we have those committees that regularly meet to discuss these issues. And then in our monthly report, we put it out there for any member of the public to review and comment on.
Okay. All right. I am just checking one other thing. All right. Dr. Morton, is there anything else that you wanted to mention that I didn't ask you?
Oh, no. I tried to cover it all.
You did. It was a very thorough testimony, and I really appreciate you making time to be here today to talk about some of these issues. And I'll add amongst my PSA that the Board of Dentistry is looking for some members to serve. So if you are a licensed dentist or a dental hygienist who has some time, don't be scared by what she said in terms of the time requirements, but this is a great opportunity for you to give back to your community.
I think if you take this position seriously, you're going to put in that time. If you're a board member who's just going to read the agenda, come and make a comment and vote, that's not what we're looking for. I mean, that's not what I would even suggest, because I take this position very seriously, and protecting the public in the District of Columbia, the patients in the District of Columbia. I take that as a very serious commitment, and I'm glad I have the time to do it now.
Well, thank you so much for your service, and also for, well, I'm gonna say congratulations on your retirement for such a distinguished career.
But I think I accept that congratulations, but you never leave your profession. I am mentoring continuously. I am volunteer lecturer at the school. I mentor youngsters who are starting their practices. So I feel very much involved. I don't feel out of the loop at all.
Great.
So
That's
I
what
have
we like to hear.
retired from getting a check. Okay. Now, if there are any positions that will pay me, I will gladly return to the workforce.
Okay.
Thank you.
Thank you so much,
Sure.
Dr. Moore. Have a great rest of your day.
Thank you.
All right, so we are now going to transition to the Board of Optometry, and Dr. Lisa Johnson is going to enter in the hot seat. Not really the hot seat. We're having a great conversation, but a little bit about the Board of Optometry. The board evaluates applicants' qualifications and administers exams, recommends standards, procedures, and issues licenses. The board receives complaints as well. They administer oaths, etc. And they also issue an annual report. The board consists of 5 residents, 4 optometrists who have engaged in the practice for at least 3 years, and then 1 consumer. Dr. Johnson, still morning. Good morning. When you're ready, you can begin your testimony.
Okay. Chairwoman Henderson, members of the Committee on Health and Staff, good morning. My name is Dr. Lisa Johnson, and I have the honor of serving as the chair of the District of Columbia Board of Optometry. On behalf of Mayor Muriel Bowser and DC Health Interim Director, Mr. Keith Fletcher, I appreciate the opportunity to share testimony with the committee here today, and I'm pleased to offer an overview of the Board of Optometry. The Board of Optometry plays a key role in regulating and advancing the practice of optometry in the district. Additionally, the board works to advance the vision health for district residents and those that visit and seek care here. I've had the honor of serving on the board since 2002 and as chair since 2021. I've been practicing optometry for over 35 years and have provided eye care to a diverse patient population, including children, seniors, and people with disabilities. I graduated as a doctor of optometry from the Pennsylvania College of Optometry in 1985 after receiving a Bachelor of Science degree from Bennett College in Greensboro, North Carolina. I also served as secretary of the Optometric Society of the District of Columbia and was a member of the Board of Trustees at Bennett College. I was born and raised here in the district, educated in DC public school system, and currently live in Ward 4. As chair, I facilitate and lead our quarterly board meetings to ensure licensees and members of the public have the opportunity to share their needs and thoughts with the Board of Optometry. The board consists of 5 members, 4 are licensed optometrists and 1 consumer member. In addition, the board is supported by a dedicated health professional licensing staff at DC Health. Together, these staff members, fellow board members, and I work diligently to review applications for licensure. This process is done with a focus on both timeliness and patient safety to ensure the district optometrists meet the established requirements to be able to practice. Through continuing education requirements set by the board, optometrists are equipped in the district with up-to-date best practices to provide valuable care in the community. Additionally, when residents or visitors seeking care in the district experience poor or unsafe optometric care, the board will review complaints, investigate, and when appropriate, take disciplinary actions to correct an issue. These actions include issuing a notice of intent to discipline, suspension, or ultimately revocation of a license. The Board of Optometry issues licenses to optometrists, and as of May 24th, 2023, we had 216 active licensees in the district. These professionals are mostly located in private clinics that directly serve communities in an outpatient setting. Our optometrists not only play a key role in improving vision health, but also advancing physical, emotional, and social well-being. The COVID-19 pandemic had a profound impact on the delivery of optometric care and overall vision health. According to a national survey of optometrists, 54% report observing vision problems due to anxiety and stress that are inconsistent with anxiety and stress related to vision issues before the pandemic. Similarly, many optometry practices reported operational and other access challenges during the pandemic. Fortunately, the licensed optometry workforce has remained stable in the district, and practitioners continue to focus on promoting positive vision health outcomes for all members of the community. The board has been working on several initiatives to advance the practice of optometry. As part of the district's Health Occupations Revision Act, the HORA, update process, the board made recommendations that would expand the scope of practice for optometrists. This proposed change would allow optometrists to address the pain management needs of their patients more effectively. The board recently voted to no longer grant sole or singular diagnostic pharmaceutical agents, DPA, authority to license optometrists, but will only grant therapeutic pharmaceutical agents, TPA. This will promote greater authority as the DPA authority is within the TPA scope of practice. Much like other health professional licensing boards, the Board of Optometry is exploring the possibility of a regional reciprocity agreement. This potential agreement would expedite and simplify the licensure process for optometrists practicing in the district, Maryland, or Virginia. I look forward to continuing to work with my fellow Board of Optometry members to advance the field of optometry in the District of Columbia. I would also like to thank the Committee on Health for their continued support of the district's healthcare workforce, including additional funding for licensing specialists in fiscal year 2023. I appreciate your time and this opportunity to testify before the Committee on Health. I look forward to any questions you may have for me at this time.
Thank you, Dr. Johnson.
You're welcome.
Okay. So it looks like there is one vacancy on your board. Is that correct?
Absolutely.
Have you all had any challenges in filling that vacancy?
Absolutely. We have been, I think since June of 2022, been trying to get a board member. I think with my memory that we were told we had somebody that was going to come on in July. We haven't seen them yet. They were going to come on in January. They weren't available in March. So.
Okay. We will follow up on that front.
We appreciate
The most recent board minutes online are from October 20th of 2022. Was that the last time that the board met?
No, we met last in March of 2020,
Okay.
no, April of 2023.
Okay, so I guess this is for the DC Health staff. If we can get those minutes updated on your website, because that wasn't there. In terms of the vacancy piece, it looks like from our data that there are about 14% of the licensed professionals under your board being DC residents. Do you feel like the residency requirement has been a barrier to getting folks to fill that last role?
It probably has. Because 14% is only 30 optometrists out of 216. I did the math. So, and I have heard some optometrists who live in Maryland say they would wish they could, participate and be on the board, but they can't because of the residency requirement.
We're just going to underscore that for people again, because you did the
Okay.
math, right? So
I did the
you
math.
have
Mhm.
a board that requires 4 optometrists, and we only have a pool of 30 to
Right.
pull from.
Yes, yes.
And you probably have called all 30.
I'm sure they've been reached out to. And then the problem is it just takes a long time for them to get through the process to get on the board.
Okay.
Mhm.
That's not us.
I know. I
That's,
know.
someone else. Okay. So in terms of the fact that you said we have 216, are we seeing an increase in the number of license applications? Are we seeing a decrease? How do we get some more professionals to come into the profession?
Well, actually, we get a steady pool of applicants who apply.
Okay.
So I think our numbers have gone up. I looked at our numbers over the last couple of months, and every month we have more and more people who have applied, been granted a license. So we have more optometrist license here in DC.
Is there currently a backlog of any sort in terms of applications?
No, there isn't. And especially right now, since it is graduation season, we're going to get another influx of applicants
Okay.
because they're just graduating.
How many staff works with your board?
So we have our executive director,
Mhm.
our board attorney, and we have our licensing specialists. That's it.
One licensing specialist. Okay. Do you all get someone detailed to you around graduation season to help deal with the influx that might come?
If needed, we'll get somebody extra. Yes.
Okay. Great. All right. So what particular significant challenges or obstacles did you all face in FY22?
The main thing that we are facing is, I'm going to try to make this shorter as opposed to longer. Okay.
Okay.
And we have, as a board, been submitting changes to our scope of practice since 2007 and also 2018, and they just haven't been approved. We have new, we have something before going to the horror right now as they change it again.
Okay.
Waiting to be approved. And we wanted to improve or change our scope of practice or change the wording for our scope of practice that would allow our optometrists to prescribe, wait a minute, let me say it this way. The proposed legislation, I'm gonna read it, what's in front of me. I can't do anything else with that one. Will increase the level of optometric care services provided to our district residents and eliminate the following, like duplication of diagnostic procedures, patient delay in receiving necessary treatment and pain relief, discontinuity of care, additional time lost from work, and significant additional fees to patients. The legislation will permit optometrists to immediately address patient needs. If a patient has experienced pain, the optometrist can then dispense or prescribe an appropriate analgesic to provide the patient with immediate comfort and relief. This is as opposed to currently requiring the patient to schedule an appointment with a second healthcare provider to receive the medications, resulting in the patient suffering unnecessary during a period of delay and incurring additional costs.
Okay.
Mhm.
So these changes we should anticipate in the upcoming HORA legislation.
Yes.
Okay. All right. And we'll have a fuller conversation about that when that comes to us.
Okay.
How many complaints has the board did the board deal with in FY 22?
And 22 was 1. Pretty sure it's 1.
Okay.
You don't get a lot.
All right. And so far in 23?
So far in 23 was none.
Okay.
Mhm.
Okay. Is I know you're focused on the licensees per se, but if I think about sort of the field altogether, especially coming off of the pandemic, where a lot of people were staring at their computer screens for extended periods of time.
Mhm.
Are we seeing increased demand for care in the district? And, do we have enough providers to meet that demand?
Now I'm gonna do like Dr. Morton said, okay? There's a Dr. Johnson answer and there's an official answer. So
Okay.
officially, I'm not sure I can answer that because I haven't talked to all
That's fine.
260.
Give
Okay.
me Dr. Johnson's
Right.
answer.
So I am sure their patients are having more difficulty because they spend more time staring at this computer. And so with that being said, they also have to take time because they don't realize what the problem is and they need to go to the eye doctor. I think there are enough optometrists, there are plenty of optometrists in the district to satisfy that need.
Okay.
Yeah.
Shout out to my optometrist, Dr. Lee.
Okay.
It's great. All right. How does the board work with our schools to make sure that students are receiving the appropriate vision and eye health screening?
That's a good question because I brought that question up to Dr. Lewis when I think she first came on. And that was one thing that I thought I wanted to see again, because students can't learn if they can't see. And, they are required to go to the dentist,
Yes.
but not required to come to an optometrist.
Which is really strange to me.
Right.
When my daughter was entering school, I was like, okay, so I have to get her teeth checked, but I don't have to get her eyes or her hearing.
Exactly. And you can't learn if you can't see or hear. So, so I don't know if at this point there is a program to either start it. I would gladly head it. But to start, just have a
Don't be
program.
volunteering, Dr. Johnson.
Oh, that's not a volunteer. I'm like Dr. Morton. If you can pay me, I can work. So, but yeah, I think there needs to be something more, because a lot of times I would see patients would come in after, or students would come into the office after being in school for 3 months. And, the problem is they can't see the board or they can't see the paper. And I mean, they've listened to a parent fuss at them for not doing well on their work, but they can't see it. So, and that's just something that's not addressed, wasn't addressed in the school. So I would like to see that type of change.
Yeah, when I was in elementary school many moons ago, I remember we had to come down to the nurse's office to do like the screen. It was like, put the spoon over your eye. Can you read, which, yeah. That kind of thing. And then if you passed, fine. If you didn't, they referred you for additional evaluation. Something very simple like that.
It needs to be a little bit more entailed to that, because someone who can see far away may have problems seeing up close, and they will pass their test. Okay. But they still can't read. They still can't see to read. So they still need to be referred out because, they need to get their eyes checked.
Right.
Right.
Is that type of initial screening something that has to be done by an optometrist?
It'd be good if it was.
Okay.
Yes. Just like initial dental screenings done by dentists.
Yeah.
A first eye exam should be done by an optometrist.
Just asking. Okay. Are there, besides the scope of practice changes that you guys are looking for, what do you anticipate the board's primary areas of focus being for the upcoming year? Like, are there other things within the profession that you guys are going to be looking to work on?
Okay, so I think to answer that question, we would be looking at doing the reciprocity stuff.
Okay.
We're going to get more into the compact. So, yeah, because with our regulatory board, we already doing something similar to it, which is called SELMO, where if you're licensed in one state or a group of states, you can be licensed. If all the states are in agreement or in this pact, then you can be licensed in another state too. So similar to what the compact is.
Okay.
Those are the main two things coming up too.
Okay. And for that SELMO, is that regional or is that national?
That would be national with our regulatory board, which
Okay.
is our, yeah. Mhm.
Okay. I would love, Dr. Johnson, and we could follow up to talk more about the vision and eye health screenings piece. Is I even know that at least for some of the charter schools, I know that they actively look for people, optometrists to come do the screenings at the beginning of the school year to
Mhm.
help, or when they're doing registration or whatnot.
Mhm.
But I would love to see it more comprehensively done as opposed to just a one-off school who is actually interested in this versus everyone saying, okay, we're going to do vision and eye and hearing screenings. Just to set kids off on the right track. But is there anything you wanted to mention that I haven't said?
I don't think so.
Okay.
I think we're
Awesome.
good. All right.
Well, Dr. Johnson, thank you so much for being here today and for your service. And as I did for everyone else, this is the PSA for anyone who is a wait, which seat?
You need an optometrist, a licensed optometrist who lives in the district that's been practicing for at least 3 years to apply to MOTA to become a member of the Board of Optometry.
Great.
So-
I think what I'm going to do is I'm going to send a message to all of my colleagues that they include some of this information in their newsletters as well, just to get the word out there for folks. Obviously, with your board, we're talking about a very small number of people, but nonetheless, who knows? Someone might know somebody. So anyway, thank you so much, Dr. Johnson. And we are now going to move on to our last board, which is the Board of Respiratory Care with Chair Carolyn Williams. A little bit about that board as they transition. Okay, so the Board of Respiratory Care regulates the practice of respiratory care in the district, evaluating applicants' qualifications. They administer examinations. They recommend standards and procedures, issue licenses, and make reports. There are 5 members of the board, 3 respiratory specialists who are licensed in the district, 1 physician with knowledge and experience in the practice of respiratory care, and also 1 consumer member. Ms. Williams, thank you so much for being with us today. It's interesting because given all that is going on in the air, respiratory care, it's almost like your time to shine in a way that we didn't hope or need. But when you're ready, you could go ahead and begin your testimony.
Yes, good morning. And the first thing I would like to say is when you can't breathe, nothing else matters. Good morning, Chairwoman Henderson, members of the Committee on Health and staff. My name is Carolyn Williams, and I have the honor of serving as the chair of the District of Columbia Board of Respiratory Care. On behalf of Mayor Muriel Bowser and the DC Health Interim Director, Mr. Keith Fletcher, I appreciate the opportunity to share testimony with the committee here today, and I'm pleased to offer an overview of the Board of Respiratory Care. The Board of Respiratory Care plays a key role in protecting the respiratory health of district residents and visitors. I have had the honor of serving as a member of the Board of Respiratory Care and as chair since 2005. I graduated with a Bachelor of Science in 1979 from the University of the District of Columbia and later returned to obtain an associate's degree in respiratory therapy. Over almost 40 years, I have worked as a respiratory care practitioner at Georgetown University Hospital and at Children's National Medical Center. In recognition of my service in the profession, I was honored as a fellow of the American Association for Respiratory Care, or FARC, FAARC, in 2015. The fellowship program recognizes members who have reached a level of distinction by contributing to the art and science of respiratory care. I am also a member of several professional organizations, including the American Association for Respiratory Care, the Maryland, D.C. Society for Respiratory Care, past ethics liaison SEIU Local 722, the University of the District of Columbia Respiratory Therapy Advisory Board, and Zeta Phi Beta Sorority Incorporated. As chair of the Board of Respiratory Care, I am proud to lead the board in its important work. The board is made up of 5 members, 3 respiratory care practitioners, 1 physician with knowledge and experience in the field, and 1 consumer member. Board members and staff review applications for licensure as respiratory care practitioners. We work diligently to ensure applicants are licensed in an efficient and timely manner. At the same time, the board makes sure that patient safety is protected by holding all applicants to the established requirements for licensure. The board is also responsible for making changes to continued education, scope of practice, and other regulatory needs facing the practice in the district. When residents or visitors experience an issue relating to poor or unsafe quality of respiratory care, the Board of Respiratory Care investigates, and when appropriate, takes disciplinary action to correct the issue. This can include issuing a notice of intent to discipline, which can result in suspension or revocation of a license. As of May 24th, 2023, there are 790 licensed respiratory care practitioners in the district. These professionals are employed in hospitals and skilled nursing facilities in the respiratory therapy departments. However, we have respiratory care practitioners that are staffed in other hospital departments, such as pulmonary, polysomnography, and extracorporeal membrane oxygenation departments, which is known as ECMO. Respiratory care practitioners in the District of Columbia work as educators in hospitals and universities, home care therapists, air and land transport team members, IT team members, and for durable medical equipment companies. The COVID-19 pandemic presented a serious challenge to the respiratory care profession across the globe. Within the district, respiratory care practitioners were on the front lines responding to some of the most severe COVID-19 cases. At the height of the pandemic, 43 times as many COVID-19 patients were using ventilators as compared to the daily average in April of 2023. As we exit the pandemic, the respiratory care profession finds itself in an important position to carefully evaluate what was learned over the past 3 years. Many professionals have gained new knowledge and skills and have learned how to address new challenges and clinical situations. As of January 2023, 28% of people who had COVID-19 either had or are currently experiencing long COVID complications. Given that millions of people will experience long COVID, respiratory care practitioners are likely to play a larger role in delivering respiratory care and education to patients than before the pandemic. As was observed prior to the pandemic and has only been exacerbated since then, the overall healthcare workforce is struggling to meet patient demands. With regards to licensed respiratory care practitioners, the number has stayed relatively stable over the past several years. However, respiratory care practitioners are facing increased patient loads due to overall patient staffing shortages. The board has been working to advance the practice of respiratory care in the District of Columbia. The Senior Deputy Director of Health Regulation and Licensing Administration, HRLA, is exploring a reciprocity agreement with Maryland and Virginia. Given similar requirements, this agreement would expedite the respiratory care licensure process for applicants already licensed in one of the participating jurisdictions. Staff for the Board of Respiratory Care plans to meet with regional partners to discuss this proposal in July of 2023. Additionally, the Board of Respiratory Care along with all other professional licensing boards, is working to streamline the application review process to within 3 business days. These efforts will ensure that eligible and qualified respiratory care professionals can attain their license in a timely manner as possible. I look forward to continuing to work with my fellow board members to advance the field of respiratory care in the District of Columbia. I would also like to thank the Committee on Health for their continued support of the District of Columbia's healthcare workforce, including additional funding for licensing specialists in the current and future fiscal year. I appreciate your time and this opportunity to testify before the Committee on Health. I look forward to any questions you may have for me at this time.
Thank you, Ms. Williams, and thank you so much for your service and serving on the board. And I asked you some similar questions that I asked your previous colleagues. So it looks like there are 2 vacancies on your board. Is that accurate?
Yes, that is correct.
Okay. One of the openings in terms of our records is for the physician who practices in respiratory care.
Yes,
Okay. How long has that seat been open?
it's been open for years, many years.
Okay. What do you think is the challenge to filling that particular role? Is it similar to what Dr. Johnson said of like, well, there are only a pool of 20 people in the city who do this, or is it something else?
Well, there are physicians that we have attempted to get placed on the board, but there was a delay. At one time, I had submitted a physician's name and resubmitted her information 2 or 3 times. And it's just challenging.
Okay, so not for lack of interest, but perhaps on our end, well, not the
Well,
council,
It-
on the
it
mayor's
was
side,
dropped. Yes,
Yeah.
the ball was dropped, yes.
the ball was dropped. Okay, so we'll follow up on that front to get folks in. What's the other vacancy?
The other vacancy is a consumer member.
Okay.
We had one recently, but she transferred to another board.
You lost your consumer to somebody else.
Yes,
I hope
we
we're
did.
not having a situation of boards poaching one another. But okay, so let's check our census numbers. How many people did you say again is licensed under your board right now?
790 respiratory care practitioners.
Okay. How many are new people versus renewals? I don't know if you have that disaggregated.
I think we
I'm
had
just trying to understand.
600. Right, I
Okay.
think we had around 600, maybe close to 700 renewals, and the other were new applicants or reinstatements,
Okay.
somewhere close to that.
For the majority of your respiratory care practitioners, what settings are they generally working in? Is it
Majority-
hospitals?
Yes,
such as
majority
yourself,
work
or-
in hospitals and in skilled nursing facilities. We have about 3 in DC that license respiratory care practitioners, but most in hospitals, but we do have some in the other areas that I named.
Okay. Are we seeing an increase of folks who are interested in the field or a decrease of folks interested in the field?
Right now, we've been seeing a decrease. We're doing things to try to encourage students, encourage students to attend the university to get an associate degree.
Okay. So do you need the specific credential to be able to license? Or let's say if you had a degree in physical therapy, is there a set of coursework that I could have taken in that to work on respiratory care? Or
Well, if you were a physical therapist, then you would have to take the core respiratory therapy classes, and then you would have to still sit for the examination and apply for a license.
okay. And you all administer the examination, is that correct?
No, we have a National Board of Respiratory Care out of Kansas
Okay,
that administers our examinations.
all right.
And our professional organization is located in Texas.
Okay. How often do they offer the exams?
The examination can be self-scheduled. They have like H&R block sites where you just call and make an appointment. It used to be twice a year, so that has increased for the profession, I guess maybe the past 10, 15 years. So when I took my boards, it was twice a year.
Oh, so if you missed the window,
Right.
you had to wait.
Right.
Okay. All right. So are there any significant challenges or obstacles the board has faced over the past year?
No major challenges, no major challenges.
All right. What would be, say, some of the major issues that you all have had outside of the licensing piece, but have there been any other, whether it be scope of work conversations or something to that effect, that you all are planning to be focused on for the coming year?
Well, the staff has some plans that they're working on the compact licensure, but
Okay.
we haven't been involved with that.
Okay. And is that a national compact? I'm like getting them all confused
In
now.
in the immediate area, DMV,
Okay,
DC,
so
Maryland, and
a
Virginia.
regional compact.
Oh, reciprocity.
Oh, reciprocity.
Reciprocity, yes.
Got it. Okay. Were there any complaints that you all had to take action on in 2022?
In 2022, we did have one complaint that we took action on, and it was resolved.
Okay. And what about so far in 23?
None so far in 2023.
Okay. Does the board have sufficient staff support and resources to expeditiously review and process applications?
I think we have the staff is able to, yes.
Okay. What would you say is the time commitment for your board?
We meet quarterly.
Okay.
I'm probably more active than most members, but quite a bit of hours, depending on what's going on.
What does that mean? Give me a range.
Well, like when we have renewals, then it may require more time.
Okay. And how often are renewals for you?
Renewals every 2 years on the odd year, January 31st.
Okay.
And
odd years.
we have delegated out authority for the staff to review the application, so there's not a delay in that process. Sometimes we are held back by school credentials, and a lot of the paperwork is not submitted for our applications. So you may have to reach back out to the licensee and have them to get paperwork sent into us so that we can complete the process.
So I know the board deals mainly in terms of, the licensing, the application, et cetera, and the scope of practice, but your statement at the very beginning, when you can't breathe, nothing else matters, I think is particularly salient. And so I'm curious, to what extent do you, as an expert in your field, communicate with DC Health around guidance or what we should be saying to the public when we have events like what's currently going on in terms of air quality?
Well, we can talk with the staff. Everyone knows about the respiratory therapists. One of the things we do is administer aerosol medications. And one thing that would help the profession right now, there's a shortage in the hospitals. We do have respiratory therapy students, and a lot of them are looking to, get some experience. However, in our guidelines, we are not able to hire them as respiratory therapy assistants, but they are hired occasionally as equipment technicians. So what they do is that they help set up the equipment. They do not and cannot do direct patient care because they are not licensed, but there are things that they could do in the department to help decrease the work flow for the therapist.
Okay.
Let's say, for example, EKGs. EKGs can be formed by a PCT, can be formed by a nurse. You do not have to be credentialed to do the EKGs.
Mhm.
But at our hospitals, at the hospital I was at, respiratory therapists do them.
Okay. is that something that should be looked at to be changed in terms of for students with supervision being able to administer?
I think for things that they do not have to have a license for, that is something that we could revisit. Years ago, we did hire respiratory therapy students in the 80s, but there was a big mess up and they were no longer allowed to do that.
Okay.
And
Well, it's been 30 years. We have other controls in place. Perhaps it's time for us to revisit. Do you know if that might be included in the HORA rewrite that's being sent over?
we have not spoken about that, so I don't think that's included.
Okay. All right. Well, DC Health staff who are listening in, perhaps you want to talk to Ms. Williams about making that a piece of this. In terms of the field of respiratory care,
Mhm.
I feel like it's something, I'm not going to call it niche, but I wonder to what extent young people who are exploring careers, et cetera, know about the profession. What can we be doing to help promote this as an area in space, especially since you're saying like you can get an associate's degree in this field?
Well, one thing that the profession do, and I participate a lot in it, is the various health fairs before COVID. Like when we had the USA Science and Engineering Festival, my organization in Texas reached out to me. They paid for the booth and wanted to know if I could find staff and bring equipment out so we could show what we do as respiratory care professionals.
Mm-hmm.
I work with the Allergy and Asthma Network in Fairfax, Virginia, participating in science fairs. When we do this, I try to recruit the students from the University of the District of Columbia to attend with me, and they do come out and volunteer to work. I go to the school on a regular basis, meet with the students, and attend their various programs. So I'm trying to push the profession and trying to get more out.
Yeah. That actually makes a lot of sense. The STEM fairs and, post-COVID, we haven't really gone back to that part yet, but that was an opportunity for a lot of young people to have exposure to things outside of just, I'm going to be a pediatrician or I'm going to be a surgeon,
Right.
but like the fact that there's so many different fields and things like that are available.
And different hospitals do attend school fairs. They're invited out to school fairs.
Okay.
Career day is what they call it now.
Okay. Is UDC the only university in the district who has a respiratory care program?
That is correct. The nearby schools is PG Community College and Salisbury is the next one that's close to us. Washington Adventist University did have one, but they no longer have that program.
Right. Well, is there anything that I haven't asked you that you want to bring to the forefront?
Yes, there is one thing. Every year during Respiratory Care Week, for the past 4 or 5 years, I've hosted an international fellow. And with that international fellow, that's someone that comes from another country and they come to the United States. They have a 3-week tour. So 1 week would be City A with me. 2nd week would be City B. The 3rd week would be at our national conference. My job during that time as the city host is that I take them to the various hospitals in DC and let them see what we do as respiratory care practitioners. And not only do I take them to the hospitals, but I also bring them here to DC Health. And Dr. Lewis has met with the past 4 that I've had. And so we try to bring exposure that way to let them see that we're working in various entities.
That's great.
And another thing I like to do since I've been on the board, during Respiratory Care Week, I like to get a proclamation from the mayor's office and present to the various hospitals. Sometimes it's a challenge getting more than one copy. I've been told that I can only get a couple of copies. It is the same proclamation, but I'm told that I'm limited. But however, last time when COVID kicked in, I was able to get one for every hospital in Washington, DC. So every hospital was delivered a respiratory care practitioner by myself and the board members. We delivered it to every hospital in DC. And I would like to ask during Respiratory Care Week, if we just ask for your attention, just to come, everybody has a hospital in their ward.
Yes,
What ward are you
yes.
in? What ward are you in?
Well, I represent the whole city.
Okay, very good. Okay, so we'll call on you to come and share some words of encouragement with respiratory care practitioners.
Okay,
Would
when
that be
is
possible?
Respiratory Care Week?
It's usually the third week in October, but I can get the information to you and make sure you have it on your calendar.
Great. I appreciate this advance notice.
You will have it by close of business today.
Oh, okay. All right. Well, thank you so much, Ms. Williams. And again, thank you for your work. And you want to give your PSA for your vacancy?
Oh, yes. Yes, we do still have the vacancies, and we do the same thing. We give the information out at our board meetings. We give the information out at our state meetings and try to pass it along at the various hospitals that we work at.
Okay, but you want to give it right here since we have folks listening?
Yes, we would like to say that during our board meetings, we have positions available for a physician and a consumer board member. So if you're interested, just contact the mayor's office, MOTA, Training and Affordability, and they will be in contact with you. If not, give me your
Talent and appointments.
talents and appointments. Okay, talents and appointments, and they will be in contact with you.
All right. Well, thank you so much for being here today. I don't have any other questions. I do have a couple of things I have to say to sort of wrap this up, but I want to express appreciation to all of our government witnesses. Sheila Holt, who is the chair of the Board of Marriage and Family Therapy, Victoria Shirk, who is the chair of the Board of Professional Counseling, Dr. Iris Jeffries Morton, who is the chair of the Board of Dentistry, Dr. Lisa Johnson, the chair of the Board of Optometry, and Ms. Carolyn Williams, who's the chair of the Board of Respiratory Care, for being here today and providing an update on the work of your various boards on behalf of residents in the district and those who are licensed to work here. 1 second, page. Okay, this concludes today's hearing of the 5 professional licensing boards. As I said at the top, we have 19 professional licensing boards within the health cluster under DC Health. We've heard from 5 earlier this year. Today we heard from 5, so we are making our way through. We're going to get to everybody else. We have 9 more to go. If anyone was not able to testify today but is interested in providing testimony, you may submit written testimony to astrange@dccouncil.gov by 5 p.m. on June 22nd, 2023. Again, astrange@dccouncil.gov. The next committee hearing will be on July 6th at 9:30 a.m. on Bill 25-244, the Prescription Drug Monitoring Program Amendment Act of 2023. And Bill 25-125, the Uniform Telehealth Act of 2023. The time is 12:41 and this hearing is adjourned. Thank you so much for your time.